Consider this. You are sitting with your mother in the hospital. The doctors have come in and told you and her that she has cancer and is terminally ill with no hopes of remission. Your mother then looks at the doctors and looks at you and decides and tells them that she has decided that she would like to commit suicide with the doctor's help. The doctor then prescribes a lethal dose of medication to help her kill herself. According to the book titled Doctor-Assisted Suicide by Gary E. McEwen, 1 in 5 U.S. physicians say they have deliberately taken action to cause a patient's death. Almost 1/4 of the internal medicine specialists say a terminally ill patient had asked them for assistance in committing suicide. Physician-assisted suicide generally refers to a practice in which the physician provides a lethal dose of medication upon the patient's request, which the patient will then use to end his or her own life. There are 2 medications that they use in order to commit the suicide. The first one is Sectinol, and this is what Sectinol looks like. Sectinol is a 10-gram dose in tablets, which are then poured out into a powder form into a glass of liquid. The other form of medicine is Nebulol, which is a liquid form of the medicine. About 5 minutes after the patient administers their medication, they will go into a coma, and they will die approximately 30 minutes later. There is a healthcare professional there with them who monitors their heart rate every 5 minutes until they pass away. According to Patricia Guthrie on the CMAJ website, currently 44 states have laws outlining physician-assisted suicide, and Virginia deems it a civil offense. 3 states have no statute that either permits or prohibits assisted suicide. In 1994, Oregon voters authorized legally assisted suicide. Since physician-assisted suicide was legalized in Oregon in 1994, over 200 terminally ill patients have opted to end their own lives. Oregon's law requires that 2 doctors consult and agree that the patient would otherwise die of natural causes within 6 months. The patient must also be considered of sound mind and be able to self-administer the drug. After Oregon passed this law, the question then becomes, should physician-assisted suicide be legalized? It is my belief that it should not be legalized. Please keep an open mind as I discuss with you the reasons why physician-assisted suicide should not be legalized. According to Margaret A. Drachmer, a doctor on the Annals of Internal Medicine website, surveys document that about 1/3 of physicians have moral, ethical, or religious objections to assisting in suicide. Upon receiving a medical degree, each doctor is required to take a Hippocratic Oath. In the book titled Euthanasia by Lisa Yount, the Hippocratic Oath says, "I swear by Apollo, the Greek god of the sun and of medicine, that I will fulfill this oath. I will apply measures for the benefit of the sick according to my ability and judgment. I will keep from harm and injustice. I will neither give a deadly drug to anybody if asked, nor will I make a suggestion to that effect." Physician-assisted suicide will be a direct violation of this oath. If this oath is violated, it would lead to a weakening of patient-doctor trust. The oath was created in part so patients could be reassured that doctors only wanted to help them, not harm them. The doctor-patient relationship will be damaged. The patient's trust in the doctor's devotion to the patient's best interest will be hard to sustain once doctors can legally prescribe death. Even conscientious physicians will have trouble caring wholeheartedly for patients once death becomes a therapeutic option. We must care for the dying, not make them dead. Physician-assisted suicide violates the Bible and God's will. According to the Bible, the 6th commandment is thou shalt not kill. Physician-assisted suicide violates this. Physician-assisted suicide is morally wrong and contradicts the Christian's beliefs and the Bible teachings that killing yourself is wrong. In Deuteronomy, the Bible says, "It is I who bring both life and death." In Romans, the Bible says, "None of us lives to himself, and none of us dies to himself. If we live to the Lord, and if we die to the Lord." So then, whether we live or die, we are the Lord's. Our lives are not ours. It is a sin to commit suicide. As Christians, we have learned to think of human life, our own and that of others, as a gift. We have not been authorized to make judgments about the worth of lives or to cut short the years that God has given us. We are to relieve suffering when we can, and to bear with those who suffer, helping them to bear their suffering when we cannot. We are never to solve the problems of suffering by eliminating those who suffer. We may think that we care when we kill, but killing is never caring. Whatever good intentions we might use to excuse it, killing is the rejection of God's command to care and of his help in caring. Those who embrace physician-assisted suicide as a means of minimizing human suffering fail to recognize God's power to redeem such situations. Another big reason for not legalizing physician-assisted suicide is that physicians can and do make mistakes. For instance, there may be uncertainty in diagnosis and prognosis. There may be errors in diagnosis and treatment. A doctor could tell a patient that he or he is terminally ill when in fact they are not. A wrong diagnosis could lead to the suicide of a savable person. Another problem arises because doctors have the ability to play God and decide who they encourage or discourage on the prospects of recovery. For example, imagine a doctor who believes that there is too much of a shortage in medical staff and resources to pour extra time and money into the sick and elderly. He may always lean towards the side of no hope when the odds are sketchy. Decision-making ability on matters of life and death should stay where it belongs, with God, not with doctors. Another reason physician-assisted suicide should not be legalized is that miracle cures or recoveries can occur. A cheerful, never-give-up attitude can often overcome the largest of odds and the worst of illnesses. You also have to consider the constant medical and pharmaceutical advances that just might lead to a miracle recovery. Medicine is constantly advancing and cures can be found. Physician-assisted suicide being legalized could force doctors and families and loved ones to give up on recovery too early. If a patient is told that he or she, for example, has 6 months to live with progressively worse pain, he may decide to end things before things start to get worse. This wipes out valuable time that could be spent with friends and family. It also denies a slim chance of recovery or the possibility of discovering doctor error. Any loosening of the assisted suicide laws could eventually lead to the abuses of privileges. For example, patients who want to die for psychological or emotional reasons could convince a doctor to help them commit suicide. Attitudes could loosen to the point that states could decide that any person can commit suicide at any time. A major concern if physician-assisted suicide is legalized is that people such as the elderly or people lacking access to care and support may be pushed into assisted death. Health insurance providers are under tremendous pressure to keep insurance premiums down. Many doctors are already prevented from giving patients certain tests or performing certain operations despite what they think is necessary. Legalized assisted suicide would likely invite another set of procedures as to when life-sustaining measures should be undertaken. Burdened family members and healthcare providers may encourage the option of assisted death. The elderly and sick may choose physician-assisted suicide because they feel that they are becoming a burden on their loved ones. In a poll taken in 2002 in Oregon, there are two main reasons that people decided to end their lives with physician-assisted suicide. One of them being that they were afraid they would be a burden on their family and their loved ones, and that was 37%. And the top reason, which was 84%, was that they felt that they would be losing their sense of independence and not be able to do things for themselves. According to Suicide, a book by Leon Koss, physician-assisted suicide, once legal, will not stay confined to the terminally ill and mentally competent who freely and knowingly elect it for themselves. We must not delude ourselves. Physician-assisted suicide is an extension of the license to kill. Once we have blurred the line between killing and allowing to die, it will be exceedingly difficult to limit the license to kill. Once the judgment is not about the worth of specific lives, our nursing homes and other institutions will present us with countless candidates for elimination who would be better off dead. Killing a patient, no matter what the law says or what their circumstances are, is still killing. People, ourselves, and others are not things to be discarded when they are no longer deemed useful. Doctors should not have the right to help someone die. They should be healers, not killers. Physician-assisted suicide should not be legalized. Suicide in any form is still suicide and should not be legal.